One of the hidden epidemics in the coronavirus pandemic has been an increase in drug overdoses, with suspected cases spiking significantly in March, April, and May, according to data from emergency medical teams, hospitals, and police. The Washington Post, using data and interviews, reports that as the pandemic continues, the cases of overdoses are accelerating. I recently spoke with Washington Post economics correspondent Heather Long about their findings. Heather, what has been happening with the overdose situation during the pandemic?
Basically, the opioid epidemic is back. Since we went to these stay-at-home mandates in late March in most of the country, we've started to see a really alarming spike in drug overdoses and in some cases overdose deaths. What we know from the data that's available, which is mostly from 911 emergency providers, is that cases were up 18% in March, 29% in April, and a really stunning 42% in May. So even as the economy was starting to reopen, there was still this real cry for help with people turning to drugs for some sort of relief.
Has this been made worse by the social isolation?
That's clearly the main driver here. I think about Steven Manzo. He's a 33-year-old outside Detroit, Michigan. I interviewed him in late March, just after he lost his bartending job. He said to me, "Just sitting at home and doing nothing is anxiety-ridden. We have no idea how long this will last." Unfortunately, 2 weeks later, he overdosed and died. And I think his situation, you could hear it. He was obviously sad about losing his job, concerned when things would get back to normal. But what he really missed was being around people, and especially being around other recovering addicts. He had struggled earlier in life with drug addiction, but all of those support networks have really been ripped away right now during this pandemic.
The funding for mental health, even pre-pandemic, was, well, to put it mildly, abysmal. How are these centers that might be a source of support for that individual or others, how are they coping through the pandemic?
Well, the early indications are very alarming. I think about the Austin Recovery Network, one of the oldest providers in Austin for substance abuse treatment. They unfortunately ran out of funding and had to close some of their overnight shelters. And they've literally had men walking into their headquarters begging them to let them back in, and they don't have beds. And even well-funded groups, some of the ones that do have better funding, I think of the Salvation Army has a large network of recovery centers across the country. I spoke to one outside Detroit, and they said, look, our calls are up 20% of people wanting to come back or wanting to come to us for the first time. But because of health and safety and social distancing requirements, we can't have as many beds right now in our facility. You know, we can only have one person per room instead of maybe 2 or 3. So we cannot offer enough help right now.
Where are people getting their drugs at this point? I mean, it seems that we've also seen indications that drug trafficking has decreased, that demand is suddenly down. What are people overdosing on?
I don't think demand is down. Basically, we're in a situation similar to what happened with toilet paper, where suddenly there was an increase in people wanting these drugs, and at the same time, the supply chain has been disrupted. There's literally reports of drugs sitting on the Mexican side of the border that just haven't been able to be moved across into the United States. And unfortunately, unlike toilet paper, drugs are not all the same. And so what we're seeing is people are getting things that are maybe much stronger than they're used to, or a weird combination. And unfortunately, that's leading to more overdoses.
How do we track this? How do we figure out whether this is a drug overdose? Obviously, when a person dies and if there's a toxicology report, but what's happening now?
That's what's so hard is we want better data, just like we want better data on coronavirus cases and what's going on, hour to hour, minute to minute with that. We would like to know the same on the opioid crisis and the overdoses. Unfortunately, we really don't have that as a country right now. The best data that we have is some counties have agreed to participate in a federal initiative where they send their 911 data in. And, obviously a lot of these people in ambulances and the police, they've seen a lot of these overdoses. They have a pretty good sense of when something is a true overdose. And so they fill that in their reporting. So what we've seen so far is 62% of counties are showing a really alarming spike in drug overdoses, but unfortunately we don't have data for all counties.
How do these counties tally this all? Meaning, on an annual basis, they must have some sort of an average on during this season or during this month, this is what happened. So all of the additional overdoses and suicides that they might be seeing at their morgue, do they put this in a category and say, this is actually attributable to the pandemic?
Well, we never know what really causes an overdose and someone to particularly take their life. Even in the case of Steve Manzo, friends and family don't believe he was trying to die that night. What we do know from this data, unfortunately, it takes a while for a confirmation. You need to do autopsy and toxicology report. That usually takes several weeks, and it's been further delayed with so much overrun at these morgues and coroner offices from the pandemic. But it's becoming clear, and in several months, we will really have the full picture that certainly in many places in the country, there has been a real spike. I think of Milwaukee County is saying 50% up right now.
So what are these service providers telling you? How do we reverse this trend or even just slow it to stop it?
That's a great question. The message that I just kept hearing over and over again as we called around the country is, first of all, recognize this is happening. I think we've all been so focused on the pandemic that we've missed this epidemic. I think another obvious step, we hope in Congress with this next stimulus to give some more funding to these recovery centers and treatment programs. There's a clear cry for help, what we're seeing. And the last one, it sounds so basic, but we do have drugs available called Narcan, which can counteract an overdose. A lot of people call it the miracle drug. And the key is getting it into enough people's hands. And what we're seeing, I just learned the state of Michigan, where Steve Manzo passed away, the state of Michigan has just announced that it is going to make for free Narcan available at community centers across the state. Let's hope other states follow suit.
Are people concerned about how these services fare in this larger conversation of defunding the police?
I would say that's an early discussion. The larger issue is most of this funding, whether it's coming through the police department, through ambulances, or for community and recovery centers, it comes from state and local budgets. And what we're seeing right now is huge budget crunches at state and local governments. They're talking about that they might have to cut fire departments and they might have to cut emergency personnel. So obviously if that happens, whether or not it's the police or the fire or the 911 staff or just less money for recovery centers, that's going to be a problem. And that's why advocates are so concerned.
Heather Long of the Washington Post, thanks so much for joining us.
Thank you.